Good morning and welcome back to 501c TV. I'm your host, Janelle Harris, and this is the podcast that talks to system change leaders, thought leaders, nonprofits, nonprofit partners, just to see what's going on out there in the world of nonprofits. And today we have Jason Kimbrell, who is the CEO of Palms West Hospital, our Palms West Hospital right here in our backyard. I'm excited to have you here today, Jason. It's a little bit unique. I want to get into your background, how you ended up the CEO of this amazing hospital, and we'll get into that because I know people always want to know the why. Like, how did you start out and end up a CEO and all that fun stuff? But also, as we were talking about, it's important that even though you're not a nonprofit, you serve a lot of our nonprofit communities, and you guys are partnered up in a lot of ways in the community. So I think it's important, and I really appreciate you being here today.
Absolutely. I've been looking forward to it.
As soon
as I saw on the calendar, I'm like, it's like Christmas, just putting the X's getting closer to the day.
That makes me feel
absolutely.
so happy. And Kind of House Studios is, they're the best. So
they're amazing.
It's always fun to come here. So without further ado, let's talk about first, you have a really cool background. I know you were like a firefighter, paramedic. So take me through all this and how we got here today.
Yeah, so I graduated high school in a part of the class that made the top 90% possible. And so, when I graduated high school, I didn't actually even graduate. The principal allowed me to walk across the stage, but I went to a Laughlin vocational school to get my last mathematics class. I graduated and didn't really have a...
And are you from around here?
From the Panhandle of Florida.
Oh, you are? Okay.
Lower Alabama, actually. LA. I tell people I'm from LA, and they're like, oh, wow, California.
You're like, how fancy.
Yeah, it's Lower Alabama.
Gulf Shores.
Yeah. Oh, yeah, you know the area.
I know the area.
Absolutely.
Yes.
So when I graduated, I had two options. I was either going to go to farrier school. I was kind of in the horses.
Oh,
Wellington.
Very cool. Yes.
Well, I was going to go in the military. So Top Gun was the greatest recruiter of all times.
Awesome.
And so went in the military, United States Air Force, and I was a firefighter, and really enjoyed that. And about 90% of the fire calls are medical in nature. And so I enjoyed that piece of it and went on to paramedic school. And I got my paramedic degree and operated kind of moonlighting as a paramedic in the same area. I was stationed active duty, got out of the military after I got back from Al Jaber, Kuwait, worked in mainstream EMS, just like you see the ambulances going up and down the street, and did that for a number of years and started just collecting more education and training and started teaching in a lot of the areas that you required licensure. And it prepared me for my dream job, which, spoiler alert, it's not the job I'm doing now. So
what? I'm surprised by this.
It's not my dream job today. I enjoy it, right? Blessed to have it.
Yes.
But no, I became a critical care flight paramedic. So I worked for a trauma center as a paramedic, and
that's so cool.
Flying in and out of scenes and night vision goggles and the whole bit. And it was that job at that time in my life when the hospital was going through what was called a Malcolm Baldrige journey. So it's the top 1% of 1% in the country, and that go through this designation to, it's focused on quality and financial growth and people and excellence. And it really baptized me in the culture. And the CEO at the time his name was Bob Murphy. It's back in the day of Bob the Builder, if you remember that cartoon.
Yes,
so,
we went through that phase with my kids.
So give you a little bit of a character reference. He was, I was working a night shift, and he was doing a town hall meeting and dressed up as Bob the Builder with his big foam cowboy hat on, and he was signifying knocking out hospital infections. And I'm eating popcorn in the back of the room in my flight suit and going, man, he's impacting healthcare at a larger scale.
Right.
I feel like I'm making my impact one patient at a time. When my helicopter lands on the scene and leaves and those sorts of things, I'm delivering care, but he's inspiring others to want to do more and become more at a larger scale. And so I said, I want to do that. And he invested in me as a mentor-protege relationship, kind of trained me like a ninja warrior as our careers kind of twisted and turned.
That's so cool.
9 years ago, I got a call from HCA and said, hey, we need a guy that looks like you in Pensacola. And I was living there.
Okay.
I was a vice president of operations there for a couple of years, and then transferred over to Sebring, Florida, and was there for 3.5 years as CEO. And blessed to be here in Palm Beach County leading this hospital.
Awesome. And how long have you been here in this role?
3 years.
3 years. Wow.
3 years.
Awesome. Good for you. Congratulations.
Yeah.
And thank you for your service too.
Well, thank you.
I appreciate that. That's cool. So tell me a little bit about Palms West Hospital. Like, how many beds? How big are they? I know there's a couple of unique things. I'll let you touch on those, and if you don't, I'll make sure you do.
Yeah, absolutely. Yeah, so the hospital was founded and built in 1986, so it's been around a good number of years, and it's gone through multiple advancements and growth, and we currently have 206 beds. And from a growth perspective and a capacity perspective, we're probably 10 years behind where we should be, just based on the growth in the community and then the perception of our care and the trust in the community. It's really filling up our hospital in a hurry. And so for us, we've really positioned ourselves to be somewhat of a boutique hospital, to where we're not trying to be all things to all people. There's 14 hospitals in this county, 3 major systems.
Totally.
You cannot be successful trying to be all things to all people. And so we've really narrowed down our focus. Our number one strategy is our ER. We try to make sure we treat every single patient like they feel like they're the only patient we have coming through the door. And we specialize in robotic assisted surgery. That's really where our brand is really resonating with the consumer.
I love the technology.
Yeah,
I'm like obsessed.
It's
any
unreal.
technology in healthcare, I'm always like, I'm like reading through the trade mags. I'm like, this is so cool. Like,
it's really cool,
and it changes so fast and so constant, and
it is.
It's pretty amazing.
And then, of course, our women's and children's services. We're the only hospital in the western part of the community that's a children's center and does that type of work. So
thank you for touching on that, because that is actually one thing I wrote down. I was like, good to know. I'm like, Scott and I, between us, have 5 kids, so I'm always like, I might need some services.
Absolutely.
But I know that the pediatric unit especially is pretty amazing and something that you guys are really well known for. So
yeah, very proud of that. We have board certified emergency room doctors in the ER 24/7. We have a 22-bed inpatient pediatric unit, pediatric intensive care unit, level 3 NICU, and just a broad range of specialties that allow patients to receive care where they live and reside.
Awesome. So I recently, speaking about reading in these trade journals and everything, I read a headline that said HCA Florida Palms West Hospital announces $80 million patient tower project.
That's a lot of money.
It's a lot of money.
It's a lot of money.
It's a very long headline. So what does that mean? What does it mean for us and for the Western communities out that way?
It's really a validation of the investment in the community, really, and understanding that we've got a special thing going here at Palms West Hospital, and we're growing at a steady clip. And so this is just an investment in the future, and it's not just an expansion going up on a floor that's currently existing.
Sure.
This is a complete build out of a brand new tower with a brand new entrance, 36-bed unit that specializes in those post-operative patients from a robotic surgery center of excellence.
So cool.
So it connects back to strategy, but it also positions us to not be a local leader in healthcare, but we really want to work to be a destination for healthcare. Being in the Wellington community and the tourism that comes in here, we want patients to be able to plan their major surgeries around their vacations or the times that they come in seasonally into the Wellington community.
Right. And that's huge. Like, I don't think, I know living here, but before I lived here, I did not realize like the influx and the ebb and flow really of people that come through this small little place on the map is like incredible. So
it's unbelievable.
It's a really great strategy. I think it's really cool. What are some of the other initiatives that you guys have going on that you're out there trying to do that are going to enhance community health?
Yeah, absolutely. As we were kind of talking before the show, I mean, the difference between a for-profit and a nonprofit that in healthcare is we pay a lot of taxes, and from a community outreach perspective, mission focused, that's how, if you come to my war room every year as we're talking about strategy, we're not looking for margin. That's not in the conversations. Sure. We focus on the mission first and trust everything else will take care of itself. And you need margin, right? Even nonprofits need margin to invest in the infrastructure and the technology to provide a healthier tomorrow for those that you're aiming to reach. And for us, if you really look at where we are, we're out in Belglade. We've got a multi-specialty practice out in Belglade where we're extended general surgery. We're getting ready to put obstetrics out there and GYN and GI and many of these other services. And we're out there because that's the mission field. Right. The margin's not there, I'll tell you right now, it's not. But we believe as an organization, and fundamentally, this is how we were founded in the late 1960s, is if we focus on the mission each and every day, everything else will take care of itself. Sure. And so as you follow the dots on where we are and the organizations that we partner with and the hundreds of millions of dollars that our organization gives to each and every day, it connects back to who we are and how we started.
Yeah, I can totally see that. And, just the whole, like, all of that expansion west, I mean,
Yeah.
it's just coming anyway. Like you
Yes.
cannot get away from it. It's just boop, 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 boop. Everything is going that way. So
It really is.
it's going to be fun to kind of see like there's the growth that's just going to naturally occur, but also, you know, if people follow along on this show, especially too, they know that those communities out west are the ones that they need those services like so badly. Like there's just a lot of communities that need that. So it's pretty cool. It's pretty cool to watch. So in that same kind of token, what are some of the challenges that you're seeing like on a healthcare level that face specifically the Western communities? Because that's kind of out that way of where you're at.
You know, access is one immediately. You see if you drive out on Belglade and Pahokee and South Bay, you see a lot of challenge, right? You see a lot of disparity that's out there.
Right.
And, access to healthcare, just in general, navigating healthcare. If you have the resources by themselves, it's hard anyway.
Absolutely.
Right.
Yeah.
I'm not sure if you've had to navigate for a loved one, but it's hard. Even as a seemingly being an expert in that area, it's even hard for me to navigate for my own. And so, knowing that those challenges, as far as access exist, the resources to navigate healthcare is definitely a problem. And then the pathology that we're seeing, the patients that are coming from the western part of the community have not had the preventative medicine that they should have for whatever reason. I know the state legislature has really had a strong push this last year, the legislative session, to put in a massive bill to be able to help out with that.
Right.
But, you know, there's 49 HCA hospitals in the state of Florida. There's 182 across our company. And that hospital in Loxahatchee, Florida is one of the leading hospitals for transfers inbound, largely because of the Western community. We are the safety net hospital for a critical access hospital in Hendry and the safety net hospital in the county.
That's awesome.
And so as we look at it, 2,500 inbound transfers last year, about 1,700 of those came from the areas that we're talking about right now.
Right.
And we're just, you know, we're not just treating patients and releasing them. If there's near misses around tumors we find that aren't cancerous, we talk about just preventative medicine and those sorts of things. But probably one of the biggest challenges, I think I would sum it up, in the Western community is exactly the issue facing all the other parts of the county is patients should not die unnecessarily of breast cancer anymore with early detection, early prevention, early intervention, same thing with prostate cancer. It's just sickening to think that patients are dying now of these types of diseases, that we know the advancement is where it should be to catch it early enough to give them a healthier tomorrow. And so that's the tough part is, you know, unfortunately we're a sick care system and not a healthcare system. And we as an organization are really trying to move towards a healthcare system and not a sick care system, so patients don't have to die unnecessarily in our community anymore.
Sure. Yeah. No, that's awesome. I love that. So, you know, I think talking to a CEO of a big hospital, you know, a lot of people are like, you know, what are some of the fun things, like fun things on a daily basis that like a CEO of a major hospital would face? So,
ooh, man.
Give me some interesting tidbits that like people would be maybe surprised or interested to know about Palms West Hospital.
You know, Palms West is super unique in that it's a large volume hospital for the size of bed count that it is, right? And so you look at the 61,000 ER visits and the amount of admissions, and our capacity remains almost 100% all the time. And when I talk to people about, most of the time I don't tell people what I do. Like if you see me out in the community, I've got my hat backwards and I'm like, I look like the guy that's working at a local gas station and not a CEO. I'm a bit unorthodox in general, but you know, when I talk to folks about hospital administration, they're like, oh wow, you got an office and you probably have an assistant and you go in and you check emails and fax things. I'm like, you don't understand.
No.
Like it is oftentimes a war zone, and there's no 2 days that are the same.
Right.
And you know, COVID's a whole nother
oh my gosh,
story.
we could do a whole nother probably episode on just that alone.
Yeah, you could do a month-long series on, hey, tell us about what you learned through COVID. Tell us about that Netflix-worthy type experiences that you have. But you know, for us, there's no 2 days that are different. It is an absolute example of problem-solving efforts every single day when you think about a team, and you oftentimes you would go to a sports type analogy, right?
Sure.
Teams, et cetera. But for us, our team is amazing at that hospital. I've been there 3 years, as I shared earlier, and there has not been one challenge that team has not been able to overcome, whether
That's
it's
awesome.
tragedy that came with COVID, or issues with overcrowding, or even the types of challenges that present themselves with patients themselves.
Sure.
And I'll give you an example. We report out every morning at 8:15 in our safety huddle, and our director of our women's services, a neonatal intensive care unit, was telling a story about a patient that was in our neonatal intensive care unit for 100 plus days. This family was at the bedside the entire time, but they were going through a tough time, right? This is a young couple that didn't have any money,
right?
And they were showing up every single day for their baby, and they had to Uber back and forth or hitch rides back and forth. And this is a couple that loves their child. You can tell that they love their child, and the patient was getting ready to get discharged, and that morning she's telling the story of just the heartfelt examples of what love looks like for this family, and just they're at a hard time in their life, and in a matter of 6 minutes, right, and that's a real number.
Okay.
In a matter of 6 minutes, that our team at Palms West Hospital came together in 300 minutes, right? I think that's about right, something like that. 300 something minutes.
We won't check your math.
Or seconds or whatever, seconds rather. 300 something seconds.
Yeah.
We pulled together $1,800
Oh
for that
my
family.
goodness gracious.
That's an example of who
so
we
cool.
are. I mean, that's an example of who we are. And so a lot of folks from the outside look in at a hospital and say, hey, they're just taking care of patients every day, and they're trying to get you better. But we show up more times in their life to be the best part of their worst day, and show up on their story that the mark on those pages can't be erased.
Totally.
Right? And so I think that's really one of the things that I would leave to whoever watches this is there's a lot of greatness going on inside the organization.
Absolutely.
And it's not even our hospital. I was doing a talk the other day about in Palm Beach County, we have some amazing healthcare systems.
Really, truly.
Really, really do. And from an economic contribution perspective and those sorts of things, that's one thing. But we have really great people in Palm Beach County, and I'm super proud of our team and what they're able to do each and every day to show up, to care for and improve human life.
Yeah, that's awesome. Let's leave off with something that you think listeners might be surprised to learn about Palms West. Could be anything.
Yeah, I think it goes back to our founders. And so we were founded in the late 1960s by three gentlemen, actually. Okay. Two were father and son, Tommy Frist Sr. and Tommy Frist Jr., both physicians. Interesting, Tommy Frist Sr., his dad was a train conductor. And
so cool.
So he was a train conductor back, you think about how long ago this was.
Yeah.
And so he was actually hit and killed by a train trying to save a young family that was stepping in front of a train. Well, Tommy Frist Sr., the founder of our company, the son of the gentleman that got killed by the train, he got brought up through a boarding school that was staffed by nurses and these sorts of things. And so he got to see what compassionate care looked like firsthand as he was kind of growing up. And
that's interesting.
Fast forward to the late 1960s, and Tommy Frist Sr. and Tommy Frist Jr. were providing health care in Middle Tennessee. And I said, you know what, we want to be able to have our own hospital to where the patients remain in the center of everything that we do and all these sorts of things. The only problem with that is when doctors go to doctor school, they don't go to business school, right? So most doctors are not real good business people.
Right.
And so Tommy Frist Sr. and Tommy Frist Jr. said, you know what, we need some help with this. We need someone that's got the business acumen, the ability to really vision cast and prepare us to not only build a hospital, but maybe down the road build a system. And so they teamed up with a gentleman named Jack Massey. That name may not ring a bell to you.
It does ring a bell to me. Why?
Well, he's actually the co-founder of Kentucky Fried Chicken. So there you go. There you go. Yes. Okay.
Wow.
Yes.
Come full circle.
It's coming full circle.
Stop, really?
Yeah, so it makes sense
cool.
though, right? So now you've got Kentucky Fried Chicken back then with McDonald's. We're building these franchises and duplication of consistency and reliability. And
systems and processes. And
fits perfect. Kentucky Fried Chicken and healthcare, right? And now
Who knew?
Yeah, so now HCA Healthcare is across 22 states, 6 countries.
Amazing.
2 countries, 6 hospitals in the United Kingdom, over 2,000 access points and almost 300,000 team members, associates, and it all goes back to passion and chicken.
Yeah, I love that.
Yeah.
No, that's actually amazing. I'm always like obsessed with how did that get started? Like, how do two people just wake up and go, you know what? Let's start a hospital today.
That's right, yeah.
And like, let's go do this. And then actually do it successfully. Like,
Right.
it's really amazing. So
It's awesome.
I really appreciate you taking the time today to be here. Like I said, we, by trade usually have nonprofits on here, but I do think it's also important to have business leaders in our community right here in here to like, you guys are out there in the trenches and working
Absolutely.
alongside a lot of our nonprofit partners that are out there trying to, do good things in the community, as are you guys. So
Absolutely.
I really appreciate you being here and taking the time to talk to us. And if you see Jason running around in a backwards hat,
That's me.
say hello.
Yes.
And anything else you would like to say before we leave?
No, thank you so very much. And again, we're out there with our nonprofits each and every day, and we're a big contributor for them to be able to
Yes.
maintain a lot of their services and programs, and that just underscores who we are as an organization. We're community focused, community centered, and that's really what makes us different. So, but
Awesome.
I'm grateful for the time to be with you.
Good. Thank you so much. I appreciate it. And thank you guys for joining us again here on 501c TV. And we'll see you next time. And again, a special thank you always to Kana House Studios, Wellington's first and only content creation studio. And we will see you next time. Thanks.